Welcome back, everyone, to The Deep Dive. Today, we're zeroing in on something really quite simple, but super important, the cholesterol test.
That's right. It might sound basic, but knowing your numbers, it's huge. So our mission today is simple. Quickly cover the big pluses of getting tested, and importantly, where you can actually do it. We're using info pulled together for the Kings Lynn area from the Blood Test UK website.
Okay, so let's break it down really simply. Like, why should you even care about this test? What's the big deal?
Well, the big deal is that high cholesterol is sneaky. It doesn't shout, no obvious signs until maybe it's, quite serious.
Right, it's major risk for serious heart trouble and even strokes. Quiet trouble, as you said.
Exactly. And the reason why is something called atherosclerosis. Basically, cholesterol can build up inside your arteries.
Arteries, like the body's pipework.
Precisely. Think of it like gunk building up in your pipes at home. It makes them narrow, harder for things to flow through, clogged drains, sort of.
Okay, that's a clear picture. So the main benefit of the test is finding this out early.
Yes. Early detection is key. If you find out your levels are high early on, you can start making simple changes sooner.
Simple changes like what? Eating better?
Yeah, like cutting back on fatty foods, eating more fruits and veggies, getting a bit more active, things like that.
And catching it early means those simple things are more likely to work, leading to, better health down the line, a longer, fuller life.
Absolutely. It gives you a chance to manage it before it becomes a major problem.
Makes sense. How often should people be thinking about this check?
Good question. For most healthy adults, the general advice is maybe every 4 to 6 years. But, and this is important, if you've got, say, heart issues in your family or maybe high blood pressure already, you'll need to check in more often. Keep a closer eye on it.
Right, those risk factors change things. Okay, let's get practical, especially for listeners in Kings Lynn. What did the info from Blood Test UK show about getting tested there?
The great news is it looks pretty accessible. The site highlights a few options. You've got places like the Kings Lynn Health Center. I think it's 123 High Street mentioned there.
Okay.
And the Queen Elizabeth Hospital, naturally. But also, even some local pharmacies like Boots might offer it. Worth checking out.
So, convenient options. That's good. What about getting ready for the test? Is there anything special you need to do? I've heard about fasting.
Yes, that's usually the main thing. You often need to fast. That means no food or drink except water for about 9 to 12 hours before the test.
9 to 12 hours. Okay. Why is that?
It just helps make sure the results, especially for certain fats in your blood, are accurate. What you just ate can affect the numbers.
Got it. And the test itself? Quick. Painful.
Oh, it's very quick. Just a simple blood draw, usually from your arm, a tiny needle prick, minimal fuss for really valuable information.
All right, so you get the results back. What are we actually looking at? I hear about good and bad cholesterol all the time.
Yeah, that's the basic breakdown. You've got HDL, that's the good kind. Think of it like a little cleaning crew, taking cholesterol away from the arteries.
Okay, good. HDL cleans.
Right. Then there's LDL, the bad kind. That's the stuff that can build up and, clog the pipes we talked about.
So you want high HDL and low LDL?
Generally, yes. Especially keeping that LDL number down. Lower is better for LDL.
So what if the results show, say, high LDL?
Yeah.
What's the next step? Does it automatically mean medication?
Not usually, no. The first step is almost always looking at lifestyle. Simple things first. Eating healthier, more fruits, vegetables, whole grains, less saturated fat, getting more active, aiming for maybe 150 minutes of walking or similar exercise a week.
And tracking the numbers helps see if those changes are actually, doing the job.
Exactly. Monitoring progress is key. You can see if your healthy choices are making a difference over, say, 3 to 6 months. It's empowering.
But what if someone does all that eats well, exercises, and the numbers are still stubbornly high?
That definitely happens. Sometimes genetics plays a big role, It's not always just about lifestyle. And that's when doctors might start talking about medication. Statins are the most common ones.
Statins? How do they work, simply put?
Well, they basically work inside your liver to block a substance your body uses to make cholesterol. So less cholesterol gets made and circulates in your blood. It tackles the production side.
Okay, so it's not just about diet then. Good to know. So wrapping this up, the main message here is that this simple test, which you can find out more about locally via resources like Blood Test UK, it really gives you control, doesn't it? Peace of mind.
Absolutely. It empowers you to manage your health journey proactively. Knowledge is power, especially here.
It really is.
Which leads to maybe a final thought for everyone listening. Thinking about all this, what's just one small heart-healthy change, maybe a food swap or adding a short walk you could start this week? even before you book that next test.
That's a great actionable thought. Start small, start now. And remember, you can find more specific details for King's Lynn, like clinic hours or booking info, by checking out the source we mentioned, the Blood Test UK website. Thanks for tuning in to this deep dive.